You're not gonna like what I'm about to say, but that low back pain you've been dealing with for years is probably not caused by what you think. Muscles get sore from workouts, yard work, you feel tightness in your shoulders and your low back. These go away after a few days. But and maybe you've even had chronic tendonitis in your elbow or in a rotator cuff, these linger for a while. But have you ever heard of anyone having tendonitis in a low back? No, you definitely haven't. Best example of this is surgeons. They never go into a back and remove a pesky muscle that's been chronically fatigued and tightened and causing pain to someone for years and years. They work on the joints. They do laminectomies, they do fusions, they do discectomies, all to address the joint problems, and the muscle stuff fades away with it. This muscle tightness is there to protect you. And actually, that combination with the joint pain sucks and it hurts. And I get that. But what you really should do is you should truly address the cause of your low back pain and combo that with massage or any type of muscle therapy, and these things do heal. So let's go through some of the screening tools that we would use to address and assess a low back. So first we'll look at flexion-extension intolerance and just the pain at the extremes as you slump forward or as you hyperextend. We want to look at hamstring indifferences and how that would pull at the low back. We want to do a Thomas test, or where you're laid back and we're checking your passive hip flexor length and just how that pulls in the low back as well. And then a one-legged stance to check your lateral, like your side-to-side stability, and watch for any lack of control in the hips or in the opposite side of the low back. If any of these are causing low back pain during the screening tests, you need to be evaluated further. But just understand that the biggest problem with your low back is probably its stability and its endurance to handle the activities of your day. Mobility and all these other things are great, but again, if your back can't handle all those, it will cause pain with time. Your low back is made to bend and twist, but it's all about stability. All the force that you create at your hips and at your shoulders, you have to be stiff at your core to help transfer that force anywhere and be athletic. All the things that we do in lifting and twisting and bending through our day are all mostly done at the hips and shoulders, and that we need to be mobile there, but stiff and stable at our core.